Hi, everyone, and welcome to another episode of Black Excellence in Healthcare White Coats and Real Talk podcast, where we highlight amazing Black healthcare professionals. I have a powerhouse guest tonight, and it's going to be so exciting. But guess what? I'm going to let her introduce herself.
Okay. Hi. Thank you for having me. I am Dr. Ashley Whitlatch. I should I tell you a little bit about me, I guess?
Absolutely. We want to know a
Okay.
little bit about you, about your journey, about your credentials, about your experience.
Okay. So I hold a doctorate of nurse practice with a master's in business. Yes, yes. I see patients. I still practice. I also teach. What else can I tell you? I have been in the healthcare field for over 18 years now. I started off as a CNA and I worked myself up. So I remember like while I was a CNA, I applied to be in the LPN program and I actually got accepted. They were like, hey, we want to bring you to the RN program. So I have literally done all the steps up. So, and I am currently in school to obtain my psych certification.
That is super amazing. Oh, girl, we got so much in common. I
Yes,
started
yes.
off as a CNA too, and I worked my way up. Actually this year make 20 years. I've been in the healthcare field. And guess what else? I'm in
Are
school for
you?
my psych.
Yes. When are you done? Or if you want it,
December. I'm done
December.
December 5th.
Okay,
Yeah,
okay.
super
I love
exciting.
that.
Yes.
So now you got to tell me
It's
the
needed.
reasons you win. Maybe we have to talk about it later. But I want to know why what your reasons are.
Of course. I felt like it was a gap. And
Hmm.
as even as a family nurse practitioner, we still encounter mental health on a daily basis with patients.
Absolutely,
And I felt like that would just getting that certification would make me more equipped to fill that gap that's out there. So,
absolutely.
yeah.
And I always feel like patients. We like you said we come in contact with it, but I always feel like I'm giving a band-aid, and I don't.
Mhm.
I want to be able to master that and know what I'm doing, so that way I can give the patient a solution instead of just something that's temporary.
Right. You are
So
absolutely right.
filling
Yes.
that gap,
Yes.
filling that gap. Yeah.
Yes. So you're gonna be dual certified. I love it. I love it. That's amazing. So I've been following you on Instagram, and little do people know I be like everybody cheerleader, especially Black women that's like excelling and just doing their things in their career. I be following you like, yes, girl, go ahead with your
Thank
best
you.
self.
Thank you.
And I notice, and I don't see too many providers that I'm following that does this, but I noticed that you specialize in gut health.
Yes, I do.
Gut
Yes, I
health,
do.
weight loss, just overall wellness, right?
Hmm.
So, along your journey, what inspired you or what encouraged you to, start specializing in gut health? Tell the audience exactly what is gut health. What is gut health? Like, why does it matter?
Okay, okay. So I will say first I started off like med surge, like urgent care, acute care. That's like my home. That's what made me into the provider that I am today. And then being exposed to different, what people are going through, their symptoms. You can't. Let me just start here. The gut is connected to so many things in our body. 70% of your immune system is in your gut. So whenever you have all these weird, strange symptoms and nobody can find the answer to them, it's in your gut. And I will say this: I don't talk about it a lot, but it is something that I went through personally. So I had the strangest symptoms. I was actually hospitalized here in
Mm.
Texas. We couldn't figure out why it was causing my thyroid was not working, not functioning at all. And so, I went and seen 7 specialists and I had to advocate for myself. A lot of people wanted to say, hey, you've got anxiety, you're a single mom and things, so advocating for myself, I found answers. Once I found my answers, I was diagnosed with an autoimmune condition. I was born with a gene that predisposes me to those and is what made my thyroid malfunction. Well, it led back to my gut. And so the
Mm.
care that I give to my patients is not only, the research and the education that I've done, but it's something that I went through personally as well.
That's amazing. That
Thank
that
you.
that that I mean, who would be the best teacher, right? Who would be
Absolutely.
the best teacher? and,
Absolutely.
and and people tend to listen more when they know you have like experienced it. Because sometimes they're like, "Oh, you just telling me this. You don't know how I feel. You never been through this." And to actually, can say, "Yes, I've been through this. I
Lived it.
experienced this, and I know."
Mhm.
That's
And weight loss goes hand in hand with it, I think.
yeah.
A lot of times people come to like a plateau with their weight loss journey and
Hmm.
they're like, I don't know what's going on. I'm doing everything. I'm doing all the things. If they check their hormones and their hormones are okay, then I'm like, we need to look in your gut. We need to check your gut. I love weight loss medicine because I love to be a part of medicine where I see the quality of my patient's life just improve. Like the celebrations, like the tears, like weight loss medicine is just, I love it. I love the celebrations.
That is awesome. I second that. Yeah,
Yes,
I
yes.
love it too. It brings so much joy when you see your work paying off and you see what.
Absolutely. You literally see, you give patients their lives back. And
Hmm.
while they're doing the hard part, I get to be the witness of that. Like, I
Hmm.
get to say, look what you did. I have patients that start with me, a few months later, like their face looks different. Like they're like, I'm able to run with my kids again. Their lives just change for the better right in front of you. I'm just happy that I get to witness it.
That's awesome. So, what do you think? Like, is some common misconceptions people have about the gut health or about weight loss?
I was actually just reading an article the other day where people could comment on it. One of the things were that, this is medicine that some people just don't believe in, that it doesn't work. It's functional medicine. So, and my thing is the gut is connected to so many things that, I mean, there's research that proves that when your gut is healed, a lot of other things can improve. So you have the brain gut access, which is another reason why I went to get my psychiatric certification, because it interests me so much that you could literally, because of something you're ingesting in your body every day, could have, inflammation in your gut. You could have a dysbiosis of your gut, and it could cause irritation, depression, brain fog, like
Mm.
all of these things that could be going on because of what is in your gut. So I would say the biggest misconception is that I think some people just don't believe in that type of medicine, but that's why I'm here to prove them not.
That's why you had to prove them wrong. You
Yes.
prove them wrong. So, what are some practical lifestyle tips or strategies you would recommend to patients who want to improve their wellness or improve their gut health?
So gut health in general, I always stick to some main things. Like what I say is simple gut health 101 for the beginners. But anybody can use it really. But the first thing is that, when you wake up in the morning, start off with water. You can add lemon to it, things like that. I know some people wake up, they get their coffee in and they're like, hey, this is
Mhm.
good. Start with water. You got to start with your water. The other thing is also water will help improve, like the hydration part of it will help improve digestion, right? The other thing is getting sunlight in the morning. Okay, so when you wake up in the morning, go for a walk, get some sunlight. It helps your circadian rhythm, which also helps your gut health and digestion. Also, walking after dinner, like if you can get your walk in the morning, get your walk in after dinner. That movement is great. Stress. I know this is something that we all live with, but stress, being able to decrease it is so important because stress can cause a lot of inflammation in our guts. So that is definitely something that we want to focus on. And other than that, just, eating fiber, lots of fiber. Okay. So, of course, the recommended dose for women, it's 21 to 25 grams right now. For men, it's 25 to 20, or sorry, 28 to 38 grams right now.
Okay. Okay. I seen something else exciting that I seen you do on your Instagram.
Okay.
The STEM for children. Oh
Yes.
my God. When I say I absolutely love that,
Thank
I
you. Thank you.
absolutely love that.
Thank you.
I don't know if you know, but I have a non-for-profit organization called Angels Helping Hands, and I mentor the youth. And actually, this past weekend, I had took them to NIU in
Okay.
DeKalb for a STEM fest. But
I love that.
Tell me or tell me and the audience about this STEM camp that you created for children.
Yes, absolutely. So, I mean, it was on my vision board for sure. And I have two small children, and I'm
Okay.
constantly educating them. And so, just to be able to, I wanted to find some way to give back to my community.
Okay.
The first one that I had was in my community in Illinois. So I went back home to launch that because that was very special to me, important. But I just wanted to find a way to be able to touch my community in a different way because I do see the entire lifespan, but I mostly work with adults. But I wanted to be able to get in there with the children, and that way they can take something with them, keep it with them, and they can see that, hey, I like doing that thing with Dr. Ashley. We learned about the gut, and I was calling them doctors, and they walked out of there with their lab
Oh,
coats, and they were
of
like,
course.
Thank
It
you,
was
thank
so
you,
cute. It was so cute and amazing. I said, that was a brilliant idea. That
thank
was a
you.
brilliant idea. And I'm sure I know it made a huge impact. To actually like just see them with the little people with their white coats on
They had
and they
stethoscopes. We
engaging.
were listening
And
to lungs. We were
yes,
listening to hearts. We learned about gut health.
I love it. That's amazing. Just for them to see that, kind of feel and be present with that kudos to you.
Thank you.
Kudos to you. And if you come back in Illinois to do another one, I want to know because I want to come.
Well, so what my plan is I definitely want to do it at home every year. So I for sure
Okay.
that's in the books. I will be home every year to do it, and maybe I can come. You're not that far from me in Illinois, so I
Right.
could go right on over
Yes.
there.
Yes. Yes, that is awesome. That is awesome. Was it a particular age range for the STEM camp?
Yeah, so I did two groups. I actually did a smaller group, and I did third grade to eighth grade, and then I did
Okay.
high schoolers. And so third grade to
Okay.
eighth grade, we really just it was more of like hands-on activities. We did fun lung activities, heart activities. We did a gut health activity. I made sure that they walked away with the pearls that they needed to know. And then with the high schoolers, we focused on the body. We had wonderful conversation just about gut health, the heart, the lungs. They got heavy duty stethoscopes and lab coats to take home with them. But we also had a conversation of if this is something that you're interested in, what do we do next? Because not only did I want them to come there and learn, I wanted them to walk away with, hey, I really enjoyed that. Now, what can I do to get there?
That's awesome. That kind of like answered my next question, but
Oh, sorry.
but that's awesome. I was about to ask you, why do you feel it's important to expose, children to healthcare and STEM fields at an early age?
Yeah, so I mean, representation matters. I
Yes.
always say that. I know if anybody ever hears me talking and things like that, that is so important to me. And it's important for the future of medicine. So,
Hmm.
as medicine has not always included all populations in order to and improve patient outcomes, I will say. So, it's important that we get everybody in medicine because that is how we improve medicine. That's how we improve patient outcomes. And that's how we improve the quality of lives of our communities.
You are absolutely right. What is like one of the most like rewarding moments you experience with your STEM camp and being involved with the youth?
So, one thing just pops into my mind here. But after the STEM camp was done, I was in my community, and I seen one of the children that participated in the camp, and she was like, "Mom," and I know her mom, but she was like, "Mom, Dr. Ashley is right there," and Dr. Ashley we called her Doctor too, and so she was like, "We're twins and we besties," and we got to talking about all the stuff that we learned, and then she walked away. She has to be what 8 or 9, and then she was like, "Clock it, Dr. Ashley."
I know that's
So I said, you
right.
know what? That made me so happy because if she can walk away feeling so fulfilled like that, I did what I was supposed to do.
Yes, you did. Yes, you did. That's amazing. That's amazing. So, how do you see like programs like that shaping the next generation of healthcare professionals?
Yeah, so I just think exposure really,
Hmm.
because I would say when I was younger, there weren't a lot of resources that kind of showed us what we can and can't do, so, I was kind of on a journey figuring things out myself. But I think that it's important to have these programs. Not only is it teaching children about their
Hmm.
body and what to look for, and hey, if something's wrong, I need to alert my parents and things like that. But it also will let them know, like, hey, this is something that I want to do, or this isn't something that I want to do. So maybe I should pursue something like this, or maybe I should go another route, or hey, I need to find a mentor that's going to help me get to this spot right here because this is where I want to be.
Absolutely. So, as a nurse practitioner, an educator, an entrepreneur, you're creating STEM camps for youth. How do you balance it all? Because you
Well,
still you look youthful, beautiful.
oh, thank
How
you,
do
thank
you
you, thank you, thank you.
balance it all?
The Lord, okay. Or I just seen a TikTok, and they asked that question, and the person that responded was like, I don't. No, but it is a thing where I have to be very, very, my calendar. If it's not on my calendar, it's not happening. So it has to be on my calendar, or it's not getting done. But my children come first. Well, the Lord comes first in my household,
Mhm.
my children. And so I prioritize my schedule around them. But after that, it's, hey, what do my patients need? How do I get my business to the next level? What do I need, to meet? What do I need to do to meet my goals?
Okay. So, what advice would you give other nurse practitioners who may want to expand their careers, go into business, go into education, go into community programs?
hmm
What advice would you give them?
So I will say a few things.
Okay.
I always harp on this one. Like, I'm sure people have seen this on my page, but use your resources. Take
Mhm.
advantage of the resources that are around you, just because they're there. They're available. You might come across something that might help you pay for your education. You never know until you utilize those resources around you. So that's the first thing. Use your resources, and whether that's you reaching out to a person, or you're going to a financial aid office, whatever the case may be, use your resources. Find out about them. Investigate about them. The other thing that I would say is just like know that no, whatever you want to do, no dream is too small. Like, no,
Mhm.
if you want to go out and create a business that nurses tying up shoes, and who knows, your dream is not too small, and it can be done, but you got to put the legwork in, right? So, and then the last thing I would say is just get a mentor. So, find somebody who is in a space where you could see yourself, where that, I want to be that, I want to do that, you align with them, with your morals and your values. Reach out to them and ask them to be your mentor, because it's going to take someone to tell you about their mistakes, so that way, they got to where they were. I got to where I was because I made some mistakes, and I want to be able to help the next person prevent that
Mhm.
from happening, so they can get to where they need to be.
Okay. So, what does Black excellence in healthcare mean to you?
So I had to write this down, because I didn't want to leave nothing out. And so
Nothing else. Okay.
so a few different things. So I'm gonna start with what I have here for me. Or let's start
Okay.
for professionally. Let's start with that first, because
Okay.
for professionally, I think Black excellence means to improve medicine. I wholeheartedly, like, I do a lot of DEI work, and I'm on committees for that, and just to be able to improve medicine, like, Black excellence means better patient outcomes for African American patients. We want better patient outcomes for everybody. But when I think about Black excellence, we are talking about making movements in medicine that weren't there before.
Right.
So that is for professionally. Now, for me, I have advocacy. Okay, I am able to advocate for my patients in a way that they may have never had before. I truly believe that Black excellence is bridging the gap where there's a lot of mistrust in medicine. And some people will come to the organization that you work for just for you because they trust you, right?
Mhm.
So showing up for my patients that have a mistrust so that way they can get a good quality of life, right?
Right.
Um, for another one for me is representation. Okay, so the young minds can see you. Maybe not even the young minds. I have people of all ages reach out to me asking for advice or guidance and things like that. So representation. This is what this looks like, and if you want to do this, you can do it too, right? And then culturally, I have few for culturally. Hope is one for me. Just just to be able to move the needle point on the face of medicine and making sure that we have equality and everybody is getting the good care that is out there. Studies, that research, that is all important when we are coming up with guidelines and new treatment plans for patients. We have to be able to be a representation in order for the quality of medicine to improve. Okay. And then one more. I got one more. Community. Black excellence is community. So we advocate for each other, things like that. And I always like to say, hey, your friends, your family members, to my patients, use me. I am a resource. I am a trusting, I want people to be able to live high quality lives and without having to doubt the care that they're getting.
That was a excellent
Okay.
response. Okay. You broke that down so great.
Look,
Just like
I had to write that down because I said, no, I cannot, I can't miss it. I can't leave anything out. I would be so upset if I did.
that is phenomenal. That and I agree with everything that you stated, and it's extremely, extremely important. Which brings me to my next question.
Okay.
Because that white coat look good over there, girl.
Oh, thank
It looks
you.
good. So, what does wearing that white coat, that beautiful white coat that I know
Mhm.
that you earned, what does that mean to you? What does that symbolizes for you?
So for me, I would say personally it is an accomplishment, but I also look at it as there's a lot of work that needs to be done. It is a thing where I feel like I am in a position to advocate, to bridge those gaps, to increase access to healthcare, and to be able to fight for my patient and advocate for them. You
Hmm.
know, and I remember being at I was at work at an organization, one of my previous organizations, and I remember someone came out and they said it was another provider, and they were like, "Well, I'm not ordering that." And I said, "You have full capability of ordering that for that patient. Why would you not do that? This
Mm.
may be the only healthcare that this person sees. This may be the only time that this person felt brave enough to even come. Or they said, you know what? I'm going to actually go try it out and give it a chance. Why would you not exhaust all your resources for a patient that is in need and you have full capability of ordering it if it's within your scope? So for me, advocacy is the first thing that comes to mind for that.
You are absolutely right. Hmm. And those are the amazing providers that,
Hmm.
do the things that they need to do to provide the best care for their patient.
Absolutely. Always go above and beyond. You never know.
Above and beyond.
We you never know what you could see or what you may find and
Hmm.
things like that. And you never know where you are making a pivotal change for one of your patients who
Right.
maybe hasn't had healthcare in 20 years because they just didn't
Hmm.
trust the healthcare system.
You are absolutely right.
So
You are absolutely right. I hope everybody listened to that part. So, on each one of my episodes, I do a segment called White Coat Confessions. This
okay.
is where, we want to get in your business a little bit.
Okay, 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 okay.
So, tell us it could be personal or professional, something that happened that you never told anyone. And when I say never told anyone, that don't include like close family and friends.
Okay.
That kind of shaped you into the woman you are today.
Ooh.
Ooh, let think about it. Think about it.
Mm. Well, I would say when you say shaped me, I would say there was two similar incidents that
Mhm.
really made me I had to shift my mind, my entire mindset.
Okay.
Um, I remember the first time that this happened, I was at work and seeing patients. I was so excited because I was like, you know what? I finally made my mind up that I am going to open my own business one day. I want to see patients the way I want to see them. And I remember feeling so excited about it. I went to work and talked about it.
Mm.
And so I remember somebody, and I will never forget what they said because it sat with me. But they looked over at me and they said, "Why would you even want to do that? This is as good as it gets right here. Why would you turn away from that?" Like, and basically insinuated like your business may not ever do this. And so I remember feeling so upset. Like, I'm sure that my face turned very red. I'm sure it did, but I remember like that night I was upset. I had to leave I left the area because I just went to the restroom to kind of like I was so excited and it felt like
Mhm.
somebody just took it away from me. And so it happened again, not in my career where I was talking to somebody who I looked up to as a role model, and the way that they would speak to me let me know what they thought about me and that they didn't believe that I could do the things that I'm capable of doing. And so I say this to say this. Every conversation cannot be had with people who do not think like you. Okay?
Mhm.
So people don't even believe in themselves. So what makes you think that they will believe in a dream that you have for you? And so those instances right there, I had to literally change my mindset, keep what I wanted to myself and pray about it to myself before I put it out in the world. And when I
Mhm.
put it out in the world, I'm very selective of who I give it to because they need to protect it. And I don't want any kind of bad, negative vibes coming back to it
Mhm.
because someone else thinks less of them and they want to put that off on me.
Mhm.
So I would
And
say that those moments definitely shaped me.
and those are some good moments, and that's something you had to experience along your journey. I tell a lot of people your desires, your visions, it's not for other people to understand. A
Absolutely.
lot of people, yeah, I'm not saying like it's something wrong working a job, but if you want to start your own business or practice how you want to practice, and that's one of the main reasons why I started my own practice, then by all means, don't let nobody put you in a box
Mm-mm.
because they only could see to the limit of themselves and they're not doing it. They're not talking about doing it.
And
So
they
when
may
you
never
come
even
talking
see
about doing it,
themselves doing something like that, you
exactly,
know?
exactly,
You have a
exactly.
big
Well,
mind. Don't give your
hmm
vision to a small mind because they don't know what to do with it. They don't know what to do with it. And those moments gave me really bad imposter syndrome. And I can remember even saying, oh, well, maybe I shouldn't do it. Like I almost question what I am doing now.
hmm
So
well, guess what? I'm proud of you.
thank you. Thank you. Thank
I'm proud of
you.
you. I know so many others are proud of you. Keep doing what you're called to do. Keep walking in your purpose, and God is going to continue to bless you beyond measure.
Thank you. I
What you're
received that. Thank
doing,
you.
not too many can do what you're doing.
Thank you. Thank you. Thank
Absolutely,
you.
absolutely. So, because I know people want to probably be in your business now
Mm, mm,
and know about Dr. Ashley and what Dr. Ashley is doing. So, what's next for you? Like, do you have any upcoming projects, any upcoming goals, ventures, or anything that you're excited about?
so honestly, right now I'm in a space where I am trying to get done with my psych certification. I signed back up for school, and then that first time was that your discussion post is due, and I'm like, another discussion
Oh my,
post.
look,
Mm,
this again. Look.
why did I do it? Why did I do it? No, but I really am enjoying my experience. I have no complaints. I want to get through that, and
Okay.
then I am focusing really on the growth of my business. Just getting AK Hybrid Health out there. I want people to know about what we offer, how we can change their lives or improve the quality of their lives, especially when they feel like they haven't had any answers. So just getting AK Hybrid Health's name out there, my platform out there.
Okay. Can you
So
tell the audience a little bit more about AK Hybrid Health?
I sure can. I sure can. So AK Hybrid Health is a nurse practitioner led clinic. Yes, yes. It is, I focus on gut health and weight loss. I will say I do have some services on there because I am very big on wanting my community to have access to healthcare. So I do still offer some acute care, some chronic care in the event that someone needs it and they can't get to access that is local to them.
Mhm.
So I still offer those things, but really I do focus on gut health and weight loss.
Okay, that's
Mhm.
awesome. And you based out in Texas, correct?
So, yes, I am based out of Texas, but it
Oh, okay.
started in Illinois. I am from Illinois. That is my home. It will always be my home. So a lot of my patients I still see a lot of patients from Illinois. So,
Okay.
yeah, I see, I think I have 6 states where I see, I'm up to 6 states, I believe, for AK Hybrid Health. So Kentucky, Virginia, Arkansas, so I can see there's a few states that I can see.
That's awesome. So tell the audience how can they reach you, and especially in all these different states. So if anybody listening that's in Illinois and Texas and Kentucky,
Call me, call
all the
me.
ones that you listed, they most definitely can book an appointment with you, right?
Absolutely, absolutely.
Okay. Well,
So the website is www.akhybridhealth.com. So AKHYBRID health.com. And from there, there's a list of services. You can book an appointment there. I also offer a discovery call. So some people may not know if it's for them or, it sounds good, but, I need a little more information on it. So I offer free consultations for weight loss. And then I offer discovery calls for gut health because that's a little more in depth, but it's free. And if you want to jump on a call, let's talk about it. Let's see if it's a right fit for you. And if it's not, maybe I can offer you some guidance or resources as to where you should be looking into. And if so, let's go because I love to be a part of the journeys. Okay, I love to see a good outcome. It literally it makes what I do all worth it.
that's awesome. So how can they follow you on social media?
So I have a page for my practice. It's
Okay.
A.K Hybrid Health. Oh, sorry, AK Hybrid Health on Instagram. So A.K Hybrid Health. And then for my Dr. Ashley life, that is MP underscore Dr. Ashley.
Okay. Okay, that's awesome. Well, I want to thank you so, so, so much, for being a guest on Black Excellence in Healthcare, White Coats and Real Talk podcast. It has been a pleasure to have you on this episode. And I'm sure that someone out there find this episode inspiring, you know, taking away new knowledge, especially about gut health and having someone to talk to that specializes in gut health and weight loss and all things wellness. Yes, yes, yes. So she already
Thank
dropped
you
her
for
social
having
media channel.
me.
Yes, absolutely, absolutely. We got to touch bases again. We most definitely going to have to touch bases again. And for those of you who are watching, you can subscribe on the YouTube channel to see the full video of this episode. You can also subscribe to the Alive Podcast Network, which is a podcast network for Black people that have some amazing podcasts. So make sure that you tune in. And of course, you can catch this episode on all podcast platforms, Spotify, You name it, it's on there. Well, until the next episode, stay blessed.